Please put your hands together as I invite Mr. Fred Swaniker, the founder, CEO of Sand Technologies. Sir, what is the correct pronunciation of your name?
Swaniker. Of course not. It's just Swaniker. It's very simple. But thank you very much, MC. I apologize. I'm not, we're here to hear from creatives. I'm not a comedian like this guy. Neither am I an actor or anything like that. Sorry, I don't, not yet for my slides. So yeah, my name is Fred Swaniker, and despite common belief, I'm a Ghanaian. I'm not a South African. Right? Yes, I'm a Ghanaian. I just want to put that out there. Yes. You are surprised. Ebony Beauty is surprised. I want to thank our host, Dr. Tinu, for inviting me to speak here at Pishan, and the chair, Madam Zuera. I have not been to Nigeria in 6 years. Well, almost, yeah, I haven't been here since 2019. Yes. Although I have a very long history with Nigeria. I came here first in the year 2000. And a lot of the work I've done has been in collaboration with Nigerians. But I haven't been here in 6 years. So, we have these two ladies to thank for inviting me to be here. And I also have my wife to thank, because this past weekend, when Zuera called me and said, can I come to this? I looked at my calendar and I said, I actually have to be out of town that weekend because my wife is hosting a bachelorette party, and she said I need to get out of the house. So she has 8 of her friends there. I don't know what they did this weekend, but I had to leave town. So I said, okay, I might as well go to Nigeria. All right, so we're going to start before my presentation with a bit of a poll. Right? So if we can have the poll, please take out your phones. We're going to see, just test our knowledge about the healthcare system in Nigeria and in Africa more broadly. So if you can please scan this QR code, and you should see the first questions come up. Got it? What does the first question say? Yes. How many patients per doctor exist in Nigeria? Yeah? So, please, have you all got the poll? Can we have the QR code back, please? Okay. For those who have not seen the QR code, scan it, and then you will see. All right. So the first question is, how many patients exist for every doctor in Nigeria? For every doctor, Kemi Ibru, Da Silva Costa, or the woman who embodies, what do you say, beauty. If beauty was a word, that's what she should be. About 15,000. 15,000. Okay, let's see the results. I think we can see the votes. Can we see the results? All right. Can we close this thing? Okay. So it ranges from 11% of you think there's 1,000 patients per doctor. 30% of you say 15,000, 6,000, so forth. Okay. Can we reveal the correct answer, please? The correct answer, according to all the research I've seen, is 9,000 patients per doctor. Right? 9,000 patients for every doctor that exists in Nigeria. Okay, let's go to the next question. Let's go to another country, South Sudan. What is the average number of patients per doctor in South Sudan? Is South Sudan better or worse than Nigeria? Not too worse. Most people think it's about 30,000 patients per doctor. Okay. So most of you think it's 30,000. So I think the average conclusion is that it's worse than Nigeria, right? Okay. Well, let's reveal the correct answer, please. 66,000. 66,000 patients for every doctor. Right? Now, let's go to the whole of Africa, the average across Africa. Nigeria, we said is 9,000, South Sudan 66,000. What's the average across the whole continent? 54 countries across Africa. Is this competitive? Okay, most people are saying 16,000 to 12,000. This is average across Africa. Okay, let's reveal the answer, please. It's 8,000. So you were influenced by South Sudan, right? So that means Nigeria is slightly worse than average. Right? But you're not the worst on the continent. So give yourselves a round of applause for that. And those few doctors that we have are leaving Africa all the time. So Ghana, where I'm from, we graduate something like 600 doctors a year. 300 doctors leave on graduation day to go to the UK and US. Right? So the point here is that at a time when our population is growing, we're going to be 40% of the world's population by the end of the century. We have fewer and fewer. We don't have enough doctors, and we have fewer and fewer doctors every year. Okay, let's go to the last question. What is the approximate number of patients per doctor in high-income regions? Let's say US, Europe. Yeah, in a given year. Yeah, at any given time. Is it 100? Is it 300, 500, 700, or 200? Okay, let's reveal the answer. It's about 300, right? So Nigeria is 30 times worse than the West, right? In terms of the shortage of doctors. So the overall point here is that if we're going to reimagine healthcare in Africa, we need to get creative. Because one of the things I really believe is that constraints drives innovation. And we have a lot of constraints. I'm not a creative in the sense of I don't act, I don't dance, I don't sing. But today I'm here to share with you what I believe with a bit of creativity. I want you to imagine a new way of delivering healthcare. Right? We forgot one last question. I forgot one last question. How many days does it take for the world's medical knowledge to double in terms of the knowledge that we have in the world about medicine? How many days is it taking to double? The world's medical knowledge doubles every how many days in terms of what we know? Okay, let's reveal the answer. Every 73 days, what we know about medicine in doubles. Every 73 days, because of all the research, all the knowledge, and that technology is allowing us to. Well, maybe I heard that Trump canceled all the research in the US, so maybe this number will slow down a bit. But today, the world's medical knowledge doubles every 73 days. So there's a lot that we're learning about the human body and medicine and so forth, public health. Every 73 days, the world's medical knowledge doubles. Okay, so I want you to remember all these facts and figures. Because I believe that if we take a step back and use the fact that we don't have enough doctors on this continent, that we don't have enough time because, we're going to be the population is growing so fast. We don't have enough resources financially, right? We're constrained. We're hit all corners, all sides of by this different constraints. We have to take a step back and reimagine and reinvent. And so what I want to share with you now is a vision for what the future of healthcare could look like, given these constraints that we have, right? How do we get out of this situation? Is there a way that we can actually use these challenges, just like we've done with mobile phone, just like we've done when we had these other constraints, to leapfrog? I remember when I came here in 2000, Nigeria was just issuing those first mobile phone licenses. And we were doing a project with McKinsey, and we were trying to download our email. We would come home from work, from the office. We were doing a project at UBA. And we would all have to scramble to fight to get to the phone line to download emails. And 30 minutes later, your email would come through. That's how things were, right? And you would hear this modem. Shh. You remember? It's very old. The young people, Gen Zs here, don't even know what that is. They just download it, go and buy airtime instead, right? That's what it was like. And I think the whole of Nigeria had 200,000 phone lines or 300,000 phone lines or something like that, right? And today, thanks to MTN and so forth, 200 million, right? Almost everyone, yeah. So, I'm going to share with you something that if we put our heads together, we can do something similar in healthcare, right? I want to introduce what I call, can I have the slides? What did I do? Okay. We're calling this the health operating system, right? This health operating system is a vision for reimagining healthcare by connecting clinical operations with AI-driven insights so that we can deliver what we want. Better service delivery. We want to optimize our resources. We already talked just now about how suddenly $60 billion, the numbers I had heard before is 12 billion, but maybe it's even better, right? That has been sucked out of the ecosystem in Africa. So in this moment, every dollar counts. How do you allocate that really, really matters, right? And how do you make better decisions? Today, our leaders are flying in the dark. You don't know where to allocate resources, what policies to make, you're guessing. So what I'm going to share with you is a system that I believe if we adopt this, can address many of these challenges. So this health operating system has 3 steps. The first thing is we have to digitize our health infrastructure, right? So this means using all kinds of smart tools, like AI-enabled diagnostic tools in clinics, monitoring our equipment, putting things like sensors in fridges to look at the temperature of vaccine, so that you can know whether a vaccine is safe to use and so forth, right? Leveraging drones to take, things like blood and medicine to clinics, right? Each clinic needs to be connected to the internet. So you can use mobile phones, we can use fiber, or you can use satellite, right? Starlink, SpaceX. Now you can connect any part of Africa to high-speed bandwidth using satellite. And so forth, right? Solar panels to bring electricity if you don't have, like we just seen, NEPA issues. You can use solar, right? So first step is you have to digitize the health infrastructure. Second part is we need to augment healthcare professionals, right? So this is about building a healthcare system, not around doctors, because the doctors are scarce. We're not saying we want to eliminate doctors. That's not what I'm saying. We're saying we want to amplify those few doctors that we have by leveraging a much more abundant resource, which is nurses and community healthcare workers, right? And this is where the technology comes in. Google's Gemini, which is their version of ChatGPT, it passed the US medical licensing exam with a score of 96%. This 91% is old. That is expert level. Why? Because remember, the world's medical knowledge is doubling every 73 days. So you, a beautiful doctor, do you as much as great as you are you recalibrating all your knowledge every 73 days? Are there any other doctors in the room? How many doctors do we have? Every 73 days. The artificial intelligence knows more than you do. I'm sorry to tell you that. Right? You know that. So AI never forgets. It's constantly updated. Every 73 days. So a nurse, just like in education, 30, 40 years ago, someone doing a PhD at Oxford had access to less knowledge than a child in a rural area in Africa today with a mobile phone. Because, when I was in college, if you were doing research, you'd have to go and do microfiche in the library. Right? Remember? Now, thanks to the internet, you have access to all this. The same thing with medicine now. So it's about taking those more abundant human capital that we have. Imagine a community healthcare worker being upgraded to be almost like a nurse. A nurse having the capabilities of a doctor having the capabilities of a specialist. Because with this, artificial intelligence is like giving every person almost like an extra 30 to 50 basis points in IQ. And IQ that doesn't forget. It's constantly updated with this, advances in medicine that we're seeing. So what is artificial intelligence? We all know about AI, right? How many of you think AI is ChatGPT? What is ChatGPT, right? I want to try and explain AI in a simple way. Who can guess this portrait? What portrait is this? A comedian, what portrait is this? This is Mona Lisa. Yes, some of you guessed. So, if you look at this, some of you guessed that this was Mona Lisa. Many of you didn't know what this was. Right? Clearly you're artists, huh? Yeah. You got it. You can see, they spend their time in the Louvre and places like that. But if you looked at this image, most of you would have guessed it, right? And of course, like you said, this is the Mona Lisa. So, artificial intelligence, at the end of the day, it's not a very complicated thing. It's about data, and it's about prediction. It's about trying to predict the future based on the past and based on data that you have. So, it looks at this image. And it's been trained on thousands of images of the Mona Lisa. And so when it sees that part, it can immediately predict that, okay, this is the Mona Lisa, right? And so that's what AI is doing. Every time it's trying to predict the future based on data, right? Like all the data that's been fed about the world's medical knowledge. But it's not about quantity of data, it's about quality of data, right? With smart data collection, you can address a lot of these problems without having to get every single piece of data. So you can see, for example, if you had just that face, you would immediately have guessed right away that this was Mona Lisa, right? So as we think about moving into this moment of AI, it's not about, very often people say, oh, we don't have the data, we don't have the structure, we can't use AI. I know you can. By being smart about the data that we collect, we can actually leverage artificial intelligence, right? So let me show you a few examples of some of the things that a community healthcare worker or nurse could do with AI. You can look at pediatric asthma care, right, like this device here. Or what about fetal monitoring? Imagine sending a community healthcare worker to every village with that belt. AI enabled, it can examine the baby inside, see if there's any complicated pregnancies. If there's an issue, you can just get on the phone, talk to the doctor by telemedicine sitting somewhere else, and you're getting the world's best medical care in every village, right? In terms of for pregnant mothers, you're able to get the knowledge embedded in that AI, right? There's medical devices like this that allows you to remotely examine a patient. So you can be sitting in Lagos, and that community health worker in the village can put that device in the ear, and you can look inside the patient's ear. You can listen to their lungs. You can, see what's going on in their mouth. You can look at all that stuff remotely from using this device. It's from Israel, Nonagon. A similar device like this. You can see these look inside the ear. You can listen to the heart rate, all that kind of stuff remotely. Clinical insights from digital voice biomarkers. Just by someone talking, you can pick up from the sound of their voice whether they've got depression or there's something wrong with them. Are they about to have a stroke? And you can use that to say, okay, you need to come into the clinic, right? This artificial intelligence can do that. Imagine driving this thing around the villages for mobile CT scan, right? Buying one of these and installing one place is expensive. But buying one of these and moving it around suddenly gives you access to a whole community. And again, this connected with the cloud. So with satellite, you can be processing the images anywhere in Nigeria. If you don't have enough doctors in Nigeria, send it to Houston. There are Nigerian doctors in Houston. They can do this for you and give you the data that you need, right? AI-enabled smartphone for ultrasound. Breast cancer screening. Imagine you have this in every village. All the women can come through and you can detect breast cancer when it's a stage 1, when it's much cheaper to treat, much more likely of success than when it's a stage 4, when it's very expensive. This is all about saving those resources that we have, right? Shifting the care from being expensive to much more predictive and preventative and much more affordable, right? Or you can look at, non-invasive glucose monitor and so forth. So the number of AI-enabled devices that the US FDA has been approving, I don't know what this is in Nigeria, every year it's getting more and more and more. And we said this intelligence is embedded in the technology because the medical knowledge doubles every 73 days. So you can just update the AI, and I don't need to send you back to school. So imagine, and this is just the beginning, right? Now all of this is centered around the community healthcare worker. So it's not about buying, and I have a new mic, I can see these things. It's not about buying one of those devices for every person in the village. Thank you. It's about equipping a community healthcare worker with a backpack. And in that backpack are all these devices. And they're on a motorbike and they're driving around the villages and they are bringing the best medical care, right, to every citizen on this continent, even in South Sudan. And so this is the second part of this new way of healthcare. The first, like I said, you have to digitize the clinics, but that digitization doesn't need to be in a big clinic. It could be in a container. It could be just the community healthcare worker that's digitized because they have a phone and they have a backpack with all these devices and they're going around and they're really bringing this, excellent care. The final part of this system is once you've connected the clinics and the community healthcare workers, and you've using all the artificial intelligence, you've augmented the healthcare professionals. That's going to give you a lot of data, right? And we talked about how AI is ultimately about data. So all that data needs to be aggregated somewhere. And so what we're advocating for is that every country needs to have what we call the National Health Intelligence Center, which brings all the data into one place. So you can see what's going on at the system level, right? You can see how many babies were born yesterday, real time. What is your disease burden by district? Are you starting to see the early signs of a pandemic? Is it the next Ebola crisis? Is it the next, COVID crisis? So again, you can react much faster, contain it before it has spread too far. And now suddenly you have to shut down the whole country. Economic costs, lives are lost. So again, this allows you to really, at the system level, stop flying in the dark. How many times today ministers make policy decisions because of people who scream the loudest often, or what the political attributes, environment calls for? You're allocating mosquito nets. Okay, every state needs one. Need the same. No. Maybe look at which states have the highest incidence of malaria. Send it there, right? Commodities. Where is this disease most prevalent? Send it there. So you can allocate your resources better. You can make healthcare policy decisions better based on data, based on facts, not on feelings, based not on who shouts the most, but rather on where is the data really saying that, right? And so this allows policymakers to allocate these few resources that they have so much better. You can therefore do much more with less, which is what we are saying right now in the continent. So I mentioned earlier that I was going to share with you a vision. But the good news is that this is not just a vision. It's actually being implemented at scale. So my organization, SAND Technologies, which is what I do today, we are rolling out 18 national health intelligence centers across Africa. The first one is open in Rwanda. You've seen it, of course. And I want to show you, so Rwanda obviously is known for pioneering some of the most innovative projects around the world, right? Like Zipline was built in Rwanda, and they fly drones, deliver blood and medicine and so forth. So one of the things that we're using, thanks to this artificial intelligence in Rwanda, they wanted to figure out where to put health facilities. And they have rules that every citizen should be no more than 30 minutes walk from a primary health facility, right? And then they want no more than an hour's walk from a health center, no more than 2 hours drive from a district hospital and so forth. So they have these rules. The only problem is the last time they did a census was maybe a decade ago, so they don't know where the people are. So we're able to use satellite imagery and machine vision to be able to map out the population. You can see where people are real time. And with that, we use artificial intelligence to look at the hilliness of the country. Because if you look on a road on a two-dimensional plane, it looks like it's a 30-minute walk. But if you count for the hill, it's actually 2 hours or 1 hour, right? So the AI can do all that stuff and simulates hundreds of thousands of placements and identified where to optimally put the facilities, and then what is the referral network, ideally between this facility and the more complicated. So we've done this in Rwanda, and so the Ministry of Health is using this tool to plan where to put the facilities based on intelligence, not because the local newspaper went to some village and said, there's no clinic here. The minister read it and suddenly they put a clinic. No, with the precision. We're able to plan where to build this infrastructure, right? This video here is from the National Health Intelligence Center in Rwanda.
Yes.
What you're seeing are all the ambulances in the country. They're being monitored real time.
I need to download my French.
In every ambulance is a camera with machine vision, and it can detect: is it a baby in the ambulance? Is it a snake bite? Is it someone with trauma? And it can use that intelligence to direct the ambulance to the best place for that treatment, real time. This is happening right now.
These monitoring stations. Really one of the value propositions that the National Health Intelligence Center has for the ministry is to be able to give them ability to get access to real-time data at the most granular level, which is the patient level. And we do that by connecting directly into electronic medical record systems.
4,000 hospitals and clinics in the country monitored real time. We can track the the temperature of the fridges, so you can know, are all our vaccines safe, right? You can monitor, disease burden. You can see all this. This is the live center. We opened this thing, right? We brought 18 ministers of health to see this, and now we're taking this to other parts of the country. One more.
The one we are seeing there is also monitoring the
monkeypox virus.
So for instance, this is mpox, the data that we're having for January, February, March. But then we also do prediction. This data.
So again, you're not flying in the dark anymore. You can see what is going on. You can make better decisions. You can plan. You can allocate those few resources that we have. And so, for example, one of the things that we discovered in Rwanda from the data is that from all the 4,000 hospitals and clinics, 90% of the maternal deaths were happening in just 3 clinics. And we dug in further and we found out that those are the clinics which are the main referral centers. So when things happen, the mothers with the complications are sent there. But as we dug in further, we realized that some of the centers are overloaded and others are underutilized. So simply by redirecting where people are being sent, you can save more lives. And we dug in further, we found that most of those deaths were happening at night. We looked further at the data, and we found out it's because the clinics and hospitals are short-staffed at night. So by changing the incentives and the pay and everything and how you... And that's what data gives you. So you can now fewer mothers are going to die because of this intelligence, right? So, again, this is not something that is happening in America. It is happening right here in Africa. The Health Intelligence Center is live. We're all invited to come and see it in Rwanda. She has been there. We're opening it by the end of this year in Botswana, Togo. I think Ghana is on the list, Senegal. We're not coming to Nigeria first yet. Sorry, why? Yes, we have not been invited. We will go where we're invited. So, thank you. And again, my challenge to all of you is that we need to use the constraints that we have as actually a powerful force for innovation. We should be, it's obviously a challenge to live in Africa with all these constraints, but it's also a blessing because it means we're not limited to the conventional ways of thinking. We have to reimagine, reinvent, and if we do that, we can actually leapfrog and build, because this system doesn't exist in the West. We're going to create the future of healthcare, not just for Africa, but for the world. Thank you.